This episode of PediaCast is brought to you by Sports Medicine and Pediatric Emergency Medicine at Nationwide Children's Hospital. Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 561. We're calling this one Pediatric Sports Injuries. I want to welcome all of you to the program. So injuries, as you know, are extremely common in children and teenagers. And sports participation is a leading cause of these injuries. Not only do injuries hurt, they also impact the student's ability to continue playing and performing. And there is some good news in all of this, though, and that is that many sports injuries are preventable. And by way of appropriate conditioning, strength training, athletic technique, and rule following, these injuries can be prevented. At other times, however, injuries are not easily prevented. They just go along with the territory of some contact sports. Whether preventable or not, the early diagnosis, management, and rehabilitation of these injuries is important so we can get these athletes back on the playing field. So that is our topic today, pediatric sports injuries and their prevention, diagnosis, and management, really with a lens on where do you go when your child is hurt with a sports injury. So do you go to an urgent care, to an emergency department, to a sports medicine clinic, to your primary care office? Where do you go, and what can you expect? And so that's really going to be our focus today as we consider pediatric sports injuries. In our usual PediaCast fashion, we have a couple of terrific guests joining us this week. Maggie is an athletic trainer at Nationwide Children's Hospital. She'll be here. And Alycia Kingcade is actually leading the conversation. She is also an athletic trainer with sports medicine at Nationwide Children's. And then we have a special guest this week. More on that soon. But first, I want to remind you, the information presented in PediaCast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you're concerned about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get Maggie, Alycia Kingcade, and our special guest settled into the studio. And then we will be back to talk about pediatric sports injuries. It's coming up right after this. Maggie is a certified athletic trainer at Nationwide Children's Hospital. She is passionate about supporting student athletes and preventing, diagnosing, and managing injuries that occur during sports participation. So let's warmly welcome Maggie to the podcast. Thank you so much for being here today.
Hi, thanks for having me.
Yeah, thank you for taking time out of your busy schedule to join us. Our second guest this week is a little unusual. It is me. For the first time in the 17-year history of this podcast, I will put on my pediatric emergency medicine hat and talk about sports injuries from the lens of acute care in the emergency department and urgent care. And then Alycia Kingcade will lead our conversation this week. She is also a certified athletic trainer at Nationwide Children's, and she also heads up the sports medicine episodes of PediaCast. She organizes them, puts them together, gets the guests together, all that sort of thing. So let's also welcome Alycia Kingcade to the program. Thanks so much for pulling this episode together.
Thanks for having me again.
Yeah, really appreciate all the hard work that you've done. So I'm going to go ahead and hand the hosting reins over to you, Alycia, and let's get going.
Awesome. Well, thank you, Maggie and Dr. Mike, for being guests on this episode. got a lot of good feedback from the last one. So I'm excited to get this episode going. So for today, I kind of wanted to talk about pediatric injuries, and some of them are specific to the age of the athlete. So today's episode, I wanted to find out more about injuries that we see specifically in the pediatric or the youth population, seeing as we are pediatric experts at Nationwide Children's Hospital. So to start off our discussion, I wanted to set the stage and determine what would be, what is the overall definition of youth or pediatric?
Yeah, that is a great question. And I think, from a policy standpoint, we use the age 21 to sort of differentiate pediatric medicine versus adult medicine. However, there's a lot of blurs in that line. And for instance, when I think about chronic illnesses that start in childhood, where the specialists really know a lot about that particular disease process. So things like cystic fibrosis, congenital heart disease, things may get a little bit, blurred in terms of who you would think of as pediatricians taking care of those kids and pediatric specialists as well. I think, too, that there's a little bit of a blur for sports medicine in terms of, we certainly see them in the pediatric age range of through high school, but that gets us to 18. So I think there is some overlap when we get to the college group of folks. But then once folks are out of college sports, I would say that they probably graduate to adult sports medicine at that point. Would you agree with that, Maggie?
Yeah, I would. In sports medicine, like you said, there's a little bit of fluctuation in when, they would kind of transition to that adult role. But for our purposes, we really look at it from are they still growing? Are their growth plates open? Are they at risk for those pediatric type injuries that we see? Just because we are going to have more experience and knowledge in how those get managed and make sure that they get managed appropriately. And sometimes that can mean that late adolescent, young adult, college age kids.
Yeah, absolutely. And I think one of the differentiating factors, too, are open growth plates, especially as we think about sports medicine and sports participation. Kids, up until the point that they're sort of transitioning from high school to college, may still have some open growth plates because they're not done growing yet. And the issue with those is they tend to be the weakest part of the joint. And so you do have to worry about growth plate injuries, especially, in middle school and high school athletes.
Exactly. That's kind of, the approach I always take when explaining to parents of our patients. As adults, we hear about somebody tearing their Achilles, playing basketball on the weekend, or their ACL, or some more muscle ligamentous type injuries. But that weakest link for our pediatric patients is bony. It's in that growth plate versus the ligaments and tendons and muscles.
Yeah, and here at Nationwide Children's Sports Medicine, one of our partners is with ODU Athletics. So we do see athletes within the collegiate realm. So it is kind of that wide variety of age per se. And then obviously the most important part is just when are the growth plates open, like you said. But this also doesn't mean that it's anybody that has to play an organized formal sport either. So I wanted to point that out. It's just kind of anybody that is active, that is, outside at recess or going to play with their friends in the park or whatever. Like it's really any active individual. But within sports, if you're being active, you could have a chance of injury. And this is what can occur with this, range of age group. But you guys kind of touched on it a little bit, talking about the growth plates and why it's important to be aware of injuries that can occur within this age group. What are the most common pediatric injuries that you see at your job site? Being in the ED and the urgent care and being in the clinical setting, just kind of what are different things you guys see?
Yeah, this always surprises me that I would say the number one sport that I see injuries from, if I had to put like one up on top, you would think it's football, but it's not. It's basketball. And we see so many ankle injuries and broken fingers from basketball. It is definitely a contact sport. So, rolled ankles, basketball, also soccer, you see a lot of ankle injuries there as well, just because, the ankles take a little bit of an extra turn and move a little more than was predicted. So you can get some stretching and a sprain. But we do want to differentiate that from growth plate injury in the ankle and a broken bone in the ankle. So we do see a lot of those. Forearm fractures are also fairly common if folks fall onto an outstretched arm. So athletes, you always, if you have the mental faculties to realize that you're falling, try to tuck and roll is the best way to save yourself from an arm fracture. But we do see those. And then concussions are common in the ED, football, wrestling. Those are pretty common. And then we don't see as many of these in the ER, but sometimes we do, especially in the beginning of a sports season. And that's just repetitive motion injuries, which can be anywhere and affect anyone. I'm thinking, baseball pitchers, gymnastics, those kind of sports. We do see just sprains and strains and muscle, I won't say tears, but, strain on the muscles, and they come in at the beginning of their sports season, and then they're in a lot of pain, and they think it's an acute injury, but it's really, has been there for a little while. So I would say from the ED and urgent care perspective, those are probably the most common.
And from the sports medicine clinic side, it's not a whole lot different. It just is a different timing and presentation, I would say. So I think, obviously the emergency room and urgent care are going to catch a few more of those acute, those falls on an outstretched hand when somebody's falling, those ankle twists and turns when they snap, crackle, and pop in the wrong direction. And so typically if we're going to see those, they may be a day or two out from that initial injury. And then we see a lot of the overuse, more chronic repetitive stress injuries that Dr. Mike was speaking to as well when it comes to throwers or even runners. It can be any sport really that will get some inflammation and growth plates and things like that.
So when talking with parents about injuries, it is kind of interesting because they do kind of think like, oh, football, you must see the most injuries here. Or, I think, basketball, I definitely see that a lot too, of the fingers and the ankles. So it's interesting how, and we'll get to that later, but how different sports can bring upon different injuries. And those are things to look for. But I wanted to touch on the word acute that you said, Dr. Mike. And I kind of wanted to go into what that is, because acute versus chronic injuries, because I think that's something that's really important to know about, and especially within pediatrics and within growth plates and things like that, knowing what is an acute versus a chronic injury and like what are some of those injuries in general. So could you guys both talk about that a little bit, of what are acute and chronic injuries within this pediatric population?
Yeah, absolutely. So there's nothing cute about acute injuries. It doesn't have anything to do with the word cute as we typically think about it. Acute just means a new injury, and particularly in the very beginning of it, when you have inflammation and pain. So, if I fall and hit my elbow, that's an acute injury. Now, if my elbow is still hurting a month later, then you would call that now a chronic injury. So it's been there for a while. So in terms of when do you start calling an acute injury now a chronic injury, that's a little gray. I would say that most acute injuries, except for fractures, are going to be better in a couple of weeks. So we usually say 7 to 10 days and then reevaluate. But the truth is, it's probably closer to 2 weeks before you're really fully back to where you were, because your body has to repair itself. But when that repair process starts to take longer, or you start to have pain over a longer period of time, then we would start to call that chronic. So probably at, the 1 to 2 week mark, certainly after 2 weeks, we would start to call that a chronic injury. Yeah.
And at that point, some of those initial symptoms, you're swelling, being really tender, having trouble walking, or putting weight on that injury, bruising, that kind of stuff will start to get better. And sometimes they heal up and you can get back to life without a problem. And then, like Dr. Mike said, sometimes they develop into more longer-term chronic injury. Their inflammation kind of sticks around and can cause some less severe but still bothersome pain and injury. Chronic injuries can also come from just overuse without an acute mechanism, I would say too. So without that fall, that twist, that pop, especially in kids, and especially when we're talking about going back to talking about growth plates a little bit, there can be a lot of repetitive stress, and it can just be from running. So talking about those kids, it's summer's kicking off. Everyone's going to be outside, running around at the playground, swimming in the pool, doing some different stuff. And that alone can cause some pain or some chronic injury. So it's important to listen to your body and take that into account as well. The last one, kind of third category I like to talk about with families and with parents is what we call an acute on chronic injury. And again, it's kind of specific to the growth and development that you see. So it's a kid that may have had some soreness and pain, maybe limited activity a little bit, but they could push through or tough it out, kind of a situation. But then they have that acute, that pop, that twist, something happens. And it's just something to be aware of, that sometimes, that's why we want to take care of those little chronic aches and pains, because we don't want something bigger to happen from it. Because sometimes that can just require a longer healing time or a little bit different management for the injury. And we want to get these kids back as fast as we can.
Yeah, as we think about acute versus chronic, one thing that comes up often, even in the emergency department and the urgent care centers, is a parent will say, could they have a stress fracture? And I think that's a term that a lot of people may not know exactly what that is. Maggie, what exactly is a stress fracture?
Yeah, so when again, stress fracture is going to be in the same vein of a chronic injury. So there's not one big episode where you fall or twist or do something that causes a pop. That repetitive stress. So typically we see stress fractures in your shin bone, often from running or a sudden increase in it was off season, I'm not doing much, and now my training has ramped up and I'm running a lot more or exercising a lot more. And that repetitive stress causes some injury to the bone. If it can, and it's graded, there's stages, depending on how far along in the stress continuum, stress reaction process it is, can be how significant it is. You can certainly just have, again, what we call a stress reaction versus a true stress fracture. And there's a wide range of symptoms and pain and processes that go on with the body that affect where you can be at in that continuum. So when it comes to stress fractures, it's a process. It's not typically an acute injury, and it's because of chronic repetitive stress.
And when the bone has that stress, it is a little more likely that then you could get an acute on chronic injury when that stress fracture becomes a real fracture all the way through the bone, because it was weaker in that location if it has a particular stress applied to it.
Exactly.
Yeah, these have been great definitions, and you guys gave a really thorough example for each. What are some examples of, or what are some more examples of acute and chronic injuries, just so the listeners know a little bit more of, let's put this definition to something we may or may not have seen yet?
Yeah, I'll let Maggie speak to the chronic injuries. For the acute injuries, the ones that we've talked about, fractures, forearm fractures, ankle sprains, those are really common. I would also say, things on the skin. So people, you fall, you may get an abrasion, you may get a bruise, you may have a laceration. So those would all be considered acute injuries. Concussions, especially right after it happens, we would call that an acute injury. Those can turn chronic as well. And you can also have complex concussions and need to see some psychology specialists to help you with the recovery from those. But I would say those are the main ones that we see. And those repetitive motion injuries are really, a lot of times they do show up acutely in an emergency room, because at some point you have this pain that really is chronic. But from the patient point of view, I was living with it and I was okay with it, and now it's affecting my performance. And so in their mind, it has become an acute injury. And I think that's why they show up in an urgent care and emergency department. But really, it's a chronic injury.
Absolutely. And examples for those chronic injuries, there's a lot of different names and technical terms. It's any of your itises, essentially. So I can have tendonitis if it's more soft tissue in a tendon. In our pediatric population, we often see what we call an apophysitis or an epiphysitis, which is chronic repetitive or chronic stress and inflammation in the growth plate or in a specific part of the bone. So those are going to be our most common chronic injuries and overuse injuries in this population.
Yeah, and I also would point out from a sports medicine point of view, because sports medicine docs are really good at treating and managing repetitive motion injuries, there are a lot of other things that maybe folks wouldn't consider sports where these same things happen. And so, as I think about marching band, for example, I think that's a sport, really, in terms of repetitive motion and the kind of injuries that you can see. And in the adult world, my wife is actually seeing a sports medicine doctor because she has shoulder problems that stem from cross-stitching. And they sent her to see sports medicine because it's a repetitive motion, and the treatment is the same. And the sports medicine folks are the experts at that. So there may be things that are sports that you don't necessarily think of as traditional sports, but the injuries occur in the same way, and the sports medicine folks really are the best folks to see.
Yeah, I'd add e-gamers to that as well. We definitely see some overuse injuries related to that. And like I said, it's just being active. Anybody that's active can be at risk for this or can have these issues. It doesn't have to be a quote athlete. They can be playing outside, just being an active individual.
Yeah, I was just thinking about Sever's disease or Sever's disease, where, that there's a pull on that Achilles tendon, so the tendinitis. And, if you're a kid and you're running outside and you're going from in summertime, you're swimming and then you're going to running on the ground and you're growing, there is that pull back there. And then, all of that just kind of encompasses. So yeah, even for, if you're not even playing a sport, these things occur and, goes back to this age population and growing on top of being active. They all kind of play a role. But are there specific age ranges that you see certain injuries that pop up? So with apophysitis, is there a specific age range that you see that more prominently, or other types of fractures or something like that?
Yeah, I will leave the apophysitis to Maggie because we don't generally diagnose that in the emergency department. In terms of patterns, I think we do see injuries at all age groups, but maybe the mechanism of injury does tend to be a little bit different. Those younger athletes, it's often an issue with technique. Maybe they're not conditioning properly before their sport, and so they're a little bit more likely to get an acute injury because they're just not really, their body wasn't ready to have this stress put under it. And then the later kids, especially as they start to specialize on a sport, then you're going to see more of those repetitive motion injuries, and just because they're using the same group of muscles over and over and over again. And then you can get, a lot of stress placed on it. But I think that we do see injuries across the age spectrum. But like I said, the mechanism of those injuries may be a little bit different.
And when it comes to the apophysitis, the growth plate inflammation, and some of those more overuse chronic repetitive motion injuries, obviously growing is going to play a role in when they most commonly happen. The growth plate needs to be open and still growing for there to be a growth plate and there to be inflammation and an injury to it. So that's going to drive it a little bit. Alycia, you previously mentioned Sever's or Sever's disease, which is one of the most common overuse or chronic repetitive stress injuries that we see. And that's going to be inflammation in the growth plate and the heel. And that's going to be a little bit younger. We're going to typically see that more middle school age range, because once you get later into high school, or even some of those young adult type ages, college age kids, that growth plate is closed. So the injury that you're going to have, the diagnosis we're going to make related to pain around your heel is going to be different because you don't have a growth plate there. And gender can play a role in that too. Obviously, development and growth and bony development, puberty is going to play a role. Girls hit that earlier. So there's certain injuries they may see, it may be more common in a younger age for the female population versus male population.
Maggie, I wanted to round back and go back to what you had mentioned a little bit earlier about specific sports. So you mentioned with apophysitis and seeing that and, seeing that as more of like a chronic injury with repetitive something. What kind of specific sports do you see in clinic that are causing certain injuries?
So I like to put the caveat out there. We have seen any and all injuries in any and all type of athletes. But there are specific sports that you're going to have more common injuries with. I mean, I think some of the best examples are your throwing athletes. So your little league shoulder or little league elbow. Those names in and of themselves kind of give you an idea of what sports we tend to see those with. So those are going to be in your throwers. But that's also any overhead athlete. So it can be common in your volleyball, tennis, swimming with that repetitive motion. Sports that are predominantly lower body, like your soccer or your track athletes that aren't throwers, they are not going to have as many shoulder injuries, or those shoulder injuries are going to be more acute and they're going to come and see Dr. Mike in the ED because it's going to be a fall, put my hand out, caught myself type of injury. So when it comes to specific sport, the level of contact, I know we talked about basketball. We often sometimes see more contact injuries than football, but the rate is going to be higher in either of those versus swimming for a contact injury, just because they're, generally a non-contact sport.
And then Dr. Mike, I wanted to know a little bit more about, without going into incredible detail, because you could talk about concussions for a very long time, but I wanted to ask about specifically your previous PediaCast episode, PediaCast CME, specifically 033, the sports-related concussion. Can you talk a little bit about that? Because you mentioned concussions earlier, and I feel like that's a common one that parents always have questions about, and there's just continuous knowledge and education coming out about concussions. So can you talk a little bit about that in that episode?
Absolutely. Concussions, the management of concussions really has changed over the last 10 years. And so if you go back in the archive of PediaCast and find a concussion episode that's more than 10 years old, you're not going to get the right advice because, science changes. And so you want to make sure that you are listening to the latest thing. And the sports-related concussion episode that we did with Dr. Stephen Cuff, episode 33, was a really good one and was very up to date. The biggest change has been that we used to recommend like total rest for folks with concussion. Like you just need to lay on the couch and not do your schoolwork, don't participate in anything, just sit and let your brain heal. But then what we found out was that the kids who did that and followed our advice, that the concussion symptoms actually lasted longer. Like the brain wants to work, and when you're working the brain, it's more likely to heal itself and put their neurotransmitters back where they're supposed to be, and all of those things. So you do have to do it safely, though. So we want to return folks, to their brain working and doing things, but we also don't want them to hurt themselves. And so when you do have a concussion, your judgment is not quite as great. Your reaction time may not be as good as it usually is. You may make decisions that aren't the best. And so subsequent injury when you are healing from a concussion is a very real possibility. And of course, we want to return kids to play at the healthiest way possible. We don't want them to get another concussion on top of the concussion that they're getting over. And so that supervised return to play is also going to be really important. And we talk about that as well in that particular episode. And by the way, I will put a link in the show notes over at PediaCast.org so folks can find that episode easily. We also have a playlist over on SoundCloud that I wanted to mention, and we'll put a link to that too. It's all of the sports medicine episodes that we do. We put into a playlist over on SoundCloud. And so there's really a ton of them, some that folks may not be familiar with, but I think are important. We did an entire episode on ankle injuries. That's PediaCast 364. We did one on martial arts and competitive dance. Of course, we've done concussion, not only the CME one is really aimed at providers who manage concussions. We also have one called Concussion Recovery and Return to Play. That was PediaCast 501. And I'll put a link to that in the show notes as well. We've done throwing injuries. We've done functional rehabilitation. So there's a lot of great content in sports medicine. If you want to find that all in one place, just go over to SoundCloud and look for that playlist.
Yeah, this is a really great resource, and obviously why we want to be doing some episodes specific within sports medicine, so that, it is a different realm and specific to sports. So yeah, so it's really great to be able to be on these episodes and go through specific topics that we're hearing from parents, so we can address these questions and get out some education. So thanks for sharing that and putting the link out there. So we've gone a lot over about what injuries occur and when we can commonly see them happening within the pediatric population. I think one question that I have for both of you would be, where should these athletes go for the diagnosis and the management of these sports injuries? Obviously, we have experience from ED and the urgent care. We have experience from the clinic. I think parents want to know, where and when do we go? Because I think that that's a big, okay, I have an ankle sprain. Do I go to the urgent care? Or do I go to, if I fractured my arm, where do you go? Can you wait, not wait for a fracture, but where do you go immediately versus when can I wait for an injury and when they occur? So can you guys talk a little bit about that, kind of the time frame and where to go?
Yeah, I can definitely see how that would be so confusing for parents. And I think in the moment when you're trying to make this decision, I would say phone a friend. And if you're on the sideline, look for the athletic trainer, ask your coach, is this something that I can see my doctor tomorrow? Or do I need a sports medicine specialist? Or do I need to go to an urgent care or an emergency room? Because those folks that are right there where you are, they're the ones who see these injuries over and over and over again. And so they get a lot of good feedback of where was the right place to go that was convenient and also maybe doesn't cost a lot of money. Certainly going to an emergency room is going to cost a lot more than going to an urgent care center, which is going to cost a lot more than going to see your regular doctor. So I would say just getting that advice. And if it's, happens while you're practicing or there's not an athletic trainer that's locally available, is to call your doctor, because your doctor has someone that's on call and they can, ask you questions and try to figure out where it's hurting and exactly what happened and can advise you on the right way to go. Now, having said that, I would say if you're worried about a bone fracture, that's one that really shouldn't wait, because we'd want to get that splinted, but we also don't want to splint an extremity unnecessarily. And so, you need an x-ray, and probably the sooner that happens, the better. If it's an obvious fracture, the arm doesn't look straight anymore, then you want to go to an emergency department, because you're probably going to need that bone set, and that's going to need sedation, and that has to happen in an emergency room. If there's not an obvious fracture, it just hurts, but everything looks okay, an urgent care is probably all right, because in that case, you still may have a fracture that needs to be set, but they can at least get the x-ray, get the splint on, and if it does need that, transfer you to the emergency department. Or depending on the fracture itself, it may be seeing orthopedics tomorrow, and they can set the fracture in their clinic, especially during flu season when the emergency room is just so crazy busy with sick kids. Sometimes the orthopedic doctors for particular fractures will be like, well, we'll fix it tomorrow, but just splint it now. So again, a visit to the urgent care may be a little bit better there. Cuts that need stitches is going to be something that needs to be seen right away. A lot of urgent cares can handle that. Emergency departments certainly can handle any suturing that would need to be done. A lot of folks do come in for ankle injuries. I'm not sure that you would have to do that unless you can't bear weight on your ankle at all, and you're worried, could there be a big bad ankle fracture? In that case, you would want to see someone sooner. But if you're just, if it hurts when you walk, but you can bear weight, you don't feel like your ankle's slipping and, doing weird things when you're walking, it just hurts and it's swollen, that may be something you could wait on and get an x-ray as an outpatient and it be managed within primary care office or a sports medicine clinic. But, of course, there's also peace of mind. And a lot of parents, and it's often the parents driving where we're going to go, and the parents want to sleep well that night and have some more information. And so, I would say then an urgent care is probably better than the ED if you're not really worried about a fracture. Concussion, where someone loses consciousness at the site, or they aren't quite sure who they are or where they are, probably ought to go to an emergency room just in case you need a CT scan of the head. Not all those kids are going to need that. And a lot of times by the time they get to the ER, they're feeling better, and we don't need to do that. But I'd say those are the main ones for the emergency department. The vast majority, I think, of injuries probably could wait for the clinic.
Yeah, I would agree wholeheartedly with everything that Mike has said. As parents, it can be really tough to make that decision in that moment of stress and seeing your child in pain or having injury, or if it is at a sporting event, the emotion of the sport gets wrapped up in all of that, and it can be really hard to decide on next steps. Whenever you have an athletic trainer at your disposal as a resource, ask your coaches, ask the site, if your school has one, reach out. They are going to be, the most helpful resource in helping you make that decision. And if it's any concern for fracture, like you said, any concern for fracture, something doesn't look right, you have a cut, laceration, bleeding, those all need to be addressed pretty immediately. But, your ankle injuries, they can sometimes be uncomfortable. They can be swollen. They can have some bruising right away, but they can wait and be seen in clinic in the next, over the next day or two, whether that's calling your primary care office and seeing what their availability is. Again, in that cold and flu season, it may be really tough sometimes for them to see an ankle injury, working it in with everything else they have. And that's where sports medicine comes in. We're going to be your resource for you to help with that. And we want to help and see those injuries.
Yeah, that was very thorough. I think that parents really can get frazzled in the moment, like you guys said. And I think it really comes down to, is it life-threatening? Does it need to be stabilized? And those are going to be the more immediate places to go. And can you wait? And can you wait till the next day or two, like you said, Maggie? And there's really like different places you can go. There's lots of options, which is awesome that we have tons of resources around us to be able to do that. But specifically, just when you get to primary care or sports medicine or, wherever you go the next day or two, they're going to be able to provide returns to activity. And that's also another important is being able to return back safely is the next part of it. So, can you wait? What are you getting back to? Those are kind of parts that go into it. So kind of wrapping up, I wanted to kind of go into a little bit about what the experience is like going to your different job sites, just so that parents are aware of, if especially for parents that have never had a child who has been injured before, what does the process look like to go to clinic, to go to the ED, and just kind of walking them through that a little bit. Obviously, it depends on the injury and it depends on a couple different things, but just kind of walking them through what can you likely expect for if your child comes to this site. Maggie, let's start with you within the sports medicine clinic.
Yeah, so we really want to be accessible for families and an option for them. So when it comes to seeing us in our sports medicine clinics, they're outpatient clinics. So we do have a location down by the main hospital, but we have locations throughout Columbus to, again, be accessible for families to come and see us. And we've tried to do things like being able to schedule online and things like that, so to make it easy for families to come see us. And then when they do come see us, our goal is really to make that visit a one-stop shop for their injuries. So they leave not only knowing what is going on with the injury and with their body, but setting them up for success moving forward from there. So when they come in, they're going to start by seeing an athletic trainer who's going to get their history, do any brief exam or testing. If they're being seen for a concussion, there's going to be a little bit more comprehensive testing that the athletic trainer is going to take them through and their basic evaluation. And then they're going to collaborate with the physician, with the doctor on ordering some x-rays. So Dr. Mike had mentioned outpatient x-rays or imaging if they can wait. So we do those in our clinics on site. So if they haven't been seen by an outside hospital or one of Nationwide Children's emergency rooms or urgent cares, we'll get some x-rays and during the visit, and then the doctor will see them and they will be able to review those x-rays. They'll do their full physical exam and then be able to talk about concerns, diagnosis, plan of care. And that plan of care we like to do as much as we can in the office. So if that does require a cast, we're going to do it in your visit. If that's a brace, if it's a walking boot, if it's crutches, anything like that, or if it's a home exercise program, it's, all right, this is just one of those overuse injuries. We need to give it some time and we need to give you some stretches to do. Here's what those stretches look like and here's how often you do them. And any other questions or education that they have. If from that point they need further care, we have, a very collaborative relationship with a lot of departments here. So if that's scheduling an MRI, or they need to go see orthopedics because it's a more complicated fracture, or they need to go to physical therapy for some more specific rehab, we're going to get all of that set up before they leave.
And Dr. Mike, can you talk a little bit about what the process would look like in the emergency department or the urgent care?
Yeah. So from an urgent care and emergency medicine standpoint, it really can look different depending on when you go. And the reason for that is that we can't predict how many people are coming in. So, we don't have appointments. So you have to just come in and see how busy it is, which if it's not busy, you'll get right in and right out. It's fantastic, but that is not the usual. Usually the emergency room is very busy with lots of patients. And so it's going to take a lot of patience also on the part of parents because you really are going to have a wait. Now, in the emergency department and the urgent cares to some extent, we do triage so that the folks who have the more critical need are going to go first. And so, if it's a broken bone that is deformed, so your arm's not straight anymore, you're probably going to get right back and not have to wait too long in the waiting room. On the other hand, if your arm hurts and you're not sure if it's broken and, you have good circulation in that arm and it looks straight and you're not in a crazy amount of pain, then you may have to wait a while. And sometimes that wait can be, 2 or 3 hours before you get back to a room, just because if there's, 100 kids in the emergency department, it just takes a while to cycle through them. And so I would say patience is going to be really a big thing. Also, if you are in that situation and things are changing, you want to make sure that you let the nursing staff know that. So, if your kid came in and their pain was a 3 and now it's an 8, let somebody know because they can at least get them some pain medicine while you're continuing to wait. So that's going to be really important. We do want to make sure that kids are comfortable, even if you're waiting to see a doctor. Also, if they need something like a sedation to get their bone straightened back out again, it's going to take a while to do the sedation, to watch them afterward. I mean, you're probably going to spend the rest of your day there. And there's just not, unfortunately, a way to get around that. The orthopedic doctors who are going to set the bone, they might be in the operating room and you have to wait until they're done there before they can come down. There might be 3 fractures ahead of you, especially in the summertime when we see a lot of kids with broken bones. So it's just a matter of having patience and understanding that the people caring for you really do care about your kid. Like when you're waiting that long, it can be easy to feel like they don't care about me. But we care about everybody. And it's just a matter of treating the kids who need it more urgently first. But then, as I always tell parents, once I'm in the room, I'm yours. I'm not going to rush through to get to everyone else just because there's a ton of people in the waiting room. Like, you've got my full attention. Let's figure this out. Let's do what's right for your kid. We appreciate your patience in waiting. But now that I'm here, I'm here. And I think that that's a good expectation to have. I think most people who work in urgent cares and emergency rooms are frustrated, just like parents are, that folks have to wait so long. And if in a perfect world, we would just have an unlimited number of rooms and an unlimited number of staff and could handle whatever comes at us. But that's just not practical to have all those people sitting around then when nobody is coming in. So it's definitely tough to balance. I think you're going to have a smoother experience when you can go to a clinic and have a time that you're supposed to be there. Certainly, especially later in the day, things can get backed up. A pro tip for parents, if you are scheduling a medical appointment of any kind, I always try to schedule first thing in the morning because it's more likely that things aren't behind at that point. Whereas if you go if your appointment's at 3:00 in the afternoon, you might have a little more of a wait depending on the cascade of issues that have come in before you. But I think that that's another reason why we say, like, if you got to go to the emergency room, go to the emergency room. But if it can wait, let it wait. And again, the best way to know which of those things to do if you're unsure is to call your doctor, ask your coach, ask the athletic trainer, and they can give you some good advice there.
Yeah, thank you guys for clarifying that process. I think I've heard from parents like frustration if their kid, sprains their ankle and then they end up going to the emergency room because, like to a parent, like your child's injured. So I'm sure that if that, it's a very urgent thing. I want to take care of things. But yeah, I think they don't realize, if it's not, like you said, Dr. Mike, like if it starts out at a 3, they're going to take somebody who is like an 8 or a 9 or, first, and especially if it's busy. So I think Maggie, you did a really great job at clarifying like all the different steps in clinic, which I think is going to be really helpful for parents to know so that they know like, oh, in a clinic, you can get an x-ray and you guys do casting and bracing. And I think parents are pleasantly surprised to know like what all we can do in clinic. So yeah, so I think that this episode is really filled with a lot of things that I have personally heard parents have questions about. And I think you guys answered really thoroughly and very clarifying, or you clarified very well. So I know that parents will appreciate that too. But I wanted to thank you guys for being on here. All the information you gave was awesome and you guys are rock stars. And I know that parents will be just happier knowing that, oh, this is so good. I needed to know this information in the event that their child gets injured. So that's why we do this. So it's good. So thank you guys.
Yeah, thank you. I think you did a great job leading the conversation. Really appreciate all your work.
Yeah, thanks for having me. This was great.
We are back with just enough time to say thanks to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks to our guest this week, Maggie Rule, athletic trainer at Nationwide Children's Hospital, and the leader of our conversation, Alycia Kingcade with sports medicine, also at Nationwide Children's. Really appreciate both of them taking time to put this information together for all of us. Don't forget, you can find PediaCast wherever podcasts are found, or in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, YouTube, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show. And we love connecting with you on social media. You'll find us on Facebook, Instagram, Threads, LinkedIn, and Twitter. X, simply search for PediaCast. Also, don't forget about our sibling podcast, PediaCast CME. It is similar to this program. We do turn the science up a couple notches and offer free continuing medical education credit for those who listen. And that is not only for doctors, we also provide credit for nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of those professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Shows and details are available at the landing site for that program, PediaCast CME. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.